three of them had stage 4 cancer. All three of them don't have cancer right now at all. And they had some serious stuff going on.
And what did they take?
Jesus. They took some, what you've heard they've taken.
Ivermectin.
Let me just start saying I respect him as an actor, but no. I just saw this video claiming that stage 4 cancer can be cured with ivermectin and something called fetendisol. But let's unpack this, because ultimately the science and the reality are very different. When people say stage 4 cancer, it sounds like one thing, but it's really an umbrella term. It means that the cancer has spread, or it's called metastasized, but stage 4 breast cancer, stage 4 colon cancer, and stage 4 lung cancer are all completely different types of diseases. They have different biology, ultimately different treatments, different outcomes, and there's no one size that fits all or a cure. First up, ivermectin. Now, ivermectin in the lab, it does some cool things. They found that in colon cancer cells, it slowed down the growth at doses that are a lot lower. In breast cancer mouse models, it did shrink some tumors and boosted the effect of something called immunotherapy, which is a cancer treatment. In studies with esophageal cancer and ivermectin, it blocks some tumor growth. So yes, the numbers look exciting in petri dishes and in animals, but here's the catch. There's no large human clinical trials that show it works against stage 4 cancer in people. In fact, have a read of this. This one specific study, which is quite prominent with ivermectin, mentions the misinformation, ethical challenges that may lead people to forego proven therapies. And us as healthcare providers must communicate responsibly and counter this misinformation. Next one up is fetendisol. This is not even a drug. Did they mean febendazole? Again, febendazole is looked at in animal models. This one study up here shows that there's absolutely no evidence that it has any value in cancer therapy. So in conclusion, the standard of care for stage 4 cancer is based on the type of cancer and its molecular profile. Treatments will include chemotherapy, immunotherapy, targeted drugs, clinical trials. These are backed by years and years of evidence with thousands and thousands of patients that undergo this kind of treatments every year. This is why oncologists who are medical specialists in cancer don't rely on single lab studies and call it a cure. The science has to prove that it works, and it works in humans rather than animal or petri dish studies.